If GLP-1 medications were just making people eat less, we would not be seeing so much success. You can only get microdosing by using a compounding pharmacy. So I've had several patients this week come in and tell me that they are microdosing through their provider, and I say, oh, okay, what dose are you on? And they're on 2.5 or 5, and I'm like, that is not a microdose. That's not even a small dose. It's just the normal starting dose. There are so many benefits to going slow, starting at a microdose, which would be under 1 milligram a week, and then working your way up slowly is the best way to get the best benefit and the lowest side effect, if any side effect at all. Totally, you can take tirzepatide with zero side effects. It's definitely possible. I have lots of patients who are under the 2.5 milligrams starting dose of tirzepatide. They have pain relief, they're sleeping better, they're losing weight, all these things, and they're on what's considered to not be an effective dose of tirzepatide. What you have to understand is that the studies are going to look for where people are losing the most amount of weight in the shortest amount of time, and that is not necessarily the best dose. Gotta understand that. And we gotta be patient, people. We gotta be patient. If you start at microdosing, it might be a couple months before you really start shedding pounds. But it won't usually be a couple months before you already start feeling the anti-inflammatory benefits, sleeping better, less stiffness in the morning, your gut's feeling better, you're pooping better. Actually, you're not having constipation, you're having the opposite. You're having the best poop you've ever had. If you're somebody who has food allergies, you might notice that you're able to eat more things that might have bothered you before. And that's because GLP-1s do a lot of healing in the gut. So there are lots of reasons to use these peptide medications. I think that they are amazing. But I do think you should work with someone and find a doctor or a clinician who has worked with them and knows what they're doing. And, 2.5 milligrams is not microdosing. So, just know that if you're looking to microdose, that's not what it is.